Next on Primary Care, examining chiropractic care and why its benefits remain underutilized in African American communities.
It's all about education. And my dad, being one of the first hospital administrators back in the old days in the 40s and 50s, when we only had black hospitals, we were only able to go to a black hospital, he educated me on being out in the community and educating patients on chiropractic care.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the program dedicated to the health and well-being of African Americans. Chronic back pain and neck pain affect millions of Americans every year, limiting how they move, sleep, and live their daily lives. For many, the search for relief leads to medication, injections, or even surgery. But there may be another path worth considering: chiropractic care. Our guest today is Dr. Herman Glass, who has spent more than 4 decades helping change the narrative in Detroit. A pioneer in holistic wellness, former president of the American Black Chiropractic Association, and founder of Glass Chiropractic Health Plaza, he has helped thousands pursue natural, collaborative approaches to better health. Dr. Glass, welcome to the show.
Thank you, Dr. Joe.
We made it.
Yes.
Good. Dr. Glass, tell us, what is chiropractic care and how does it differ from traditional medicine?
Well, the chiropractic treatment is unique because it's a non-surgical treatment to align the segments of the spine. A lot of times patients will hear a slight popping sound, but it's not a bone popping. It's actually the joint space, the intervertebral disc expanding. The medical term is molecular expansion in the spinal cord, relieving pressure where the nerves are trying to go through the spine. And the chiropractor identifies those areas of misalignment that will cause either pressure on the nerve, compression in the disc, and eventually, if they don't get care, it will cause degenerative disc disease or even advanced diagnosis like spondylolisthesis. And the chiropractor, in a non-surgical way, helps identify those misalignments and helps that patient function better.
So patients don't need to be afraid of the term spinal adjustment.
Correct. A lot of times patients will come in and, for example, and going way back to the 80s, I used to be the chiropractor for the tug-of-war team for the police department when they would pull against the Canadian side. And some of the real big guys, and I'm not a big guy, some of the real big guys will come in and the other officers would drag the guy in and they'd look down at me, they're 6'5" and everything, and say, what's he gonna do? I get him on the table and work the technique, procedure technique, to relieve pressure, usually in their lower back. About 70% of our cases are lower back pain, but we get a lot of problems, a lot of cases that come in with neck and shoulder, mid-back thoracic pain, and we're able to identify those areas and help relieve pressure in the spine. And sometimes the chiropractic adjustment or technique or alignment, relieving subluxations, luxations in the spine, gives them instant relief, and it's just very satisfying for the chiropractor to do that.
So basically, you're affecting the nervous system and the bone structural system.
Yes, the central nervous system, as you know, as a physician for a lot of years, controls everything in the body. It's almost like, well, I tell patients when the embryo forms in the mother, one of the first things to develop is the central nervous system. They call it the tree of life coming in the embryo. And if we can affect that as patients develop, even young patients with scoliosis or misalignments, or we work with some of the coaches down at Cass Tech and some of the high schools for trauma. But those instances where we can relieve pressure in the spine early are significant for function and for that patient to heal better.
So in a community like this, we have to always be concerned about what's being prescribed, whether it's a controlled substance or not. How does chiropractic care help reduce the reliance on pain medications, and particularly opioids?
Well, going back to even the history of chiropractic back in the 1800s, relieving pain, and back in the days in the 1800s, it was some of the rural patients who were working on the farm and getting back pain, and the chiropractor would help in the rural sectors. Subsequently, it's become more mainstream now. I've been in practice 44 years, so when I first went into practice, it was not as mainstream as now. We get more and more allopathic referrals from doctors like you, Dr. Joe, from Dr. Maddox, David Williams, president of Detroit Medical Society. Those doctors feed into me for patients who are looking for a non-surgical alternative to pain in their back. And then we use some of the herbals, CBD, cannabidioids that help alleviate pain without that patient being, taking the opioids so many times.
Herman, in most disease states, we try to seek parity where we get equal outcomes regardless of the patient population or ethnic groups. But in chiropractic care, it appears, and not just appears, it is that African American patients aren't getting to chiropractic care at the same rate as others. Is there a reason for that?
Well, being past president of our National Black Chiropractors Association, and proud to say being the first member of the board in Lansing in 1988, there's 5 doctors that sit on the board that license all the chiropractors in the state, and so I broke the color barrier in 1988. I was able to educate more African American patients to take advantage of the non-surgical treatment of chiropractic care. My dad, being one of the first black hospital administrators back in the 40s and 50s, when I first went into practice in the early 80s, he told me, "You're going into the churches." So we use a network with Mr. Junius Williams, who runs a lot of the health fairs at the churches, at Greater Grace in Hartford and some of the smaller churches, to educate people on what we do as chiropractors, and then being able to network with the few African American chiropractors in the city. There's almost 3,000 chiropractors in the state of Michigan, and to count so far, we have about 17 or 18 African American chiropractors in the whole state. That includes the doctors I know in Flint and Grand Rapids, Lansing. So we have a long way to go, but me being past president of our national association, we give out scholarships, and I've mentored certain doctors, like a new doctor I have now, Dr. Brittany Davis, joined me last year, and I helped mentor her over the years in the chiropractic curriculum down in Atlanta. And I'm proud to say she's done well and specializes in women's holistic health, because some patients prefer a female doctor to work on the chiropractic care with them, and we have that.
Speaking of that, patients like to feel very comfortable with their providers. They like to put a trust in our opinion, what we prescribe and what we do. How important is this cultural competency in chiropractic care?
Well, it's an inter-network, and I call it collaborative medicine, as most physicians are getting into now, working with more of the holistic part and the traditional part of medicine coming together rather than being separate, so that patients can get a full realm of care from all these sequences, from wellness care to preventive care to acute critical care, which you take care of all the time. So those are the factors that we incorporate in my clinic at Glass Chiropractic, and to help patients like your referrals, that I appreciate, and Dr. Maddox, Dr. David Williams, Dr. William Sharp, some of the primary care doctors that I've known for years that trust me with their patients.
So you built a great network here in the city in terms of the referral base, and it's bidirectional, really. I mean, we see patients that you refer. You see our patients over the years and have had great outcomes. How does that work in terms of expanding the scope, getting the better outcomes, elevating the level of care in terms of chiropractic being an integral part of a patient's care program?
Well, since the early 80s, and I've mentored a number of chiropractic physicians in the state, and I incorporate them in networking because some of our patients do not have primary care doctors, or some of the patients that come in and we ask about their PCP and they say, well, I go to this clinic and sometimes I see this doctor or this doctor. So we refer them particularly to the doctors that we know. Dr. Michael Taylor, you know, a lot of the doctors that are familiar with my practice and comfortable with our referrals going directly to them, and they get very good VIP care when we make that personal referral, and it's so important for that collaboration.
Right. So it's not one versus the other. In a lot of instances, as a matter of fact, the vast majority of instances, it's both.
Yes, it's called working together for the full outcome of the patient, whether it's the wellness patient, patient coming to me the other day, construction worker, he just wants to stay well and stay on the job, having some minor problems, or patients that are carried into my clinic. I've been on the same corner for 41 years, so patients know to bring their patients in if they have some back pain, trying to avoid surgery. And I mean, we have good surgeons that we refer to. Dr. Michael Roberts, he actually helps me with some patients at my clinic, orthopedic surgeon. So we have that whole network to make sure that that outcome of that patient is full.
So you fit into the current thinking of trying to expand and elevate the care of the community, the concept of patient-centered medical homes or coordinated care. Chiropractic care fits into that as a service line.
Yes, and it's all about, of course, the network. I'm proud to be part of the Detroit Medical Society and be able to collaborate with the other physicians there, and also talk to some of the medical students that come along that want to know about my practice. They're going into traditional medical care, but they want to know about my practice, especially the young doctors. They're just so influenced by the natural part of healthcare and the traditional part of healthcare.
They help keep you young, don't they?
Yes, yes.
Good.
At 73 years old and 44 years in practice, I'm trying to stay young like you.
That's a great career. Great. We're going to take a short break. Stay with us. We'll be right back.
Even the mighty might not see it coming. It's prediabetes, and it captures 1 in 3 adults. But you can escape. Take the 1-minute prediabetes risk test to know where you stand and prevent or delay type 2 diabetes. Be your own hero on smartphones everywhere at doihaveprediabetes.org.
Where did the time go? I don't know how I got here.
You've done the hard part. You quit smoking. Now do the easy part and get scanned for lung cancer. If you smoked, you may still be at risk, but early detection could save your life. Talk to your doctor and learn more at savedbythescan.org.
Welcome back. We're here with chiropractor Dr. Herman Glass of Glass Chiropractic Health Plaza. Dr. Glass, you've helped a lot of people lose weight over the years. Tell us some of your approaches as compared to some of the more popular things that we're dealing with today in the weight loss arena.
Well, going back to the chiropractic treatment mode, a lot of patients will come in and they're overweight and having lower back pain. So we have a natural program for losing weight, an alternative to the injectables and the medication that's taken. Sometimes we'll even get a referral from a few of the clinics that do the injectables for weight loss, because some patients, a certain percentage of patients, will have some side effects and gastrointestinal problems. So we have a natural program that helps them lose weight. And subsequently, if they lose the belly fat, lose some of the weight around the middle of their body, structurally, it will help not compress the disc, and we're trying to decompress the disc with the chiropractic treatment and alignment. And we have a 30-day program. We have a 10-day detox program. Have over almost 30 patients who've lost 100 pounds and kept it off for a year. And then we have an herb that helps with toning and tightening so that those patients will possibly eliminate the cosmetic surgery corrections that are
flaps
painful.
in various
Flaps
areas,
and,
yes.
Yeah, and getting some infection in between the folds. So we've helped patients. I've been on the medical board with a weight loss company for over 20 years. And it's a fitness company that I use all natural. So we're able to use some of these modalities that are herbal to help correspond with what you're prescribing as a primary care physician and trying to help your patients over the hump as they come in with, you label them as obese, and we're able to help them in a natural way. And it helps their overall function. It helps eventually with their blood pressure, cholesterol, sugar, their diabetes, if they're pre-diabetic. If we can get them to lose some weight naturally, it helps them down the road. And then, of course, the primary care doctor is happy as we're trying to help them in a natural way to avoid surgery and any other treatment that may be more invasive.
You know, we've had patients to lose significant weight, as you know. We've been able to adjust medications for diabetes and hypertension, and in some instances, eliminate medications simply because of the weight loss that has been achieved. But there's a segment of people out here, especially with this society being so into exercise and working out and stuff. What about the patient who has no medical problems, who just wants to seek chiropractic care just to maintain, to stay in, you know, keep the neck from getting out of alignment as well as the spine?
Yes, we get a number of those patients because we have a number of patients who work out all the time. And sometimes at the gym, they'll ask Joe or they'll ask Buddy, what do you do to stay in shape? And a lot of times, I'm fortunate, they'll say, well, Dr. Glass keeps me in line so that I can function better. And keeping the spine in line and functioning and keeping the disc spaces open is critical to not getting pinched nerves in certain areas. And then we have special posture support pillows for sleeping. A couple of the critical things is stretching. Like I've mentioned before, stretching is so important. All the patient has to do is watch Mother Nature, watch their animals, the dogs and cats. What do they do when they get up? They stretch. We get up sometimes, we're out the bed, in the kitchen, bathroom, out the door, we don't think about it. And even the older we get, unfortunately, the more you have to stretch to keep those areas moving and keep the fluid around the joints from degenerating the joint. And once it's degenerated, then we have to send Dr. Michael Roberts for replacement parts as an orthopedic surgeon. So if we can prevent that with proper chiropractic alignment and care and stretching, it makes good sense. I tease patients all the time, and it's going to sound a little funny. I tell patients, I'm like the alignment guy. Like, you wouldn't drive your car around with a misalignment in the steering wheel for miles and miles and miles. You go to Bell Tire. I say, I'm like the physician that lines your body up so you can function and roll better.
So basically, you have a model here, and these are the areas that chiropractic focuses on in terms of treating patients.
Yes, if we can keep the intervertebral disc open, and that's where all the nerve endings flow through, the IVF, there's a nerve between each one. If we can decompress, and again, the decompression, sometimes you get a little popping sound, but the medical term is molecular gas expansion in the spinal cord. It's not a bone or anything. I'm keeping the disc space open. My oldest patient is 99. I told her 20 years ago, I'm going to keep you out of the wheelchair with preventive care. And most seniors, it may come in once a month or twice a month, just for hands-on preventive care to keep the disc spaces open. And I tell patients, I'm keeping you from shrinking as you get older. I'm decompressing the spine. I'm keeping those areas open because as we age, we naturally shrink, but it's all about the IVF. It's all about the disc. If the disc shrinks, then that's where you lose your height. And I'm maintaining that height. We're not magically going to regenerate the disc, but let's save what's still there.
So people have to function in various capacities, and one of them is at work during the day. Daytime posture can be a contributor to, or can also be one of the things that we can address to talk about how we prevent disc disease from occurring simply because you got to go and sit at a desk 8 hours a day.
I've got some free exercises, and Dr. Joe, I've given out free exercises at health fairs for 40 years.
Yes, I have some from you.
Yes, and these exercises help. I even have exercises for a patient that sits for 8 hours at the desk. And, if they call my office, Dr. Glass at 313-533-2225, mention Dr. Joe, I'll give them free exercises. We don't even have to bill their Blue Cross or Medicare or anything. Certain things we do for free, and that's why we are here with you.
So basically, there are some alternatives that patients can seek in terms of feeling better, staying healthy, and treating conditions that they have acquired, unfortunately. How do we tell this story in a broader sense? The fear of seeing doctors sometimes extends to seeing a chiropractor at all. And we mentioned earlier, I don't want them snapping my spine or adjusting my neck. That story needs to be told differently. And I think these kinds of explanations really help in terms of what you're really doing to help those patients.
Yeah, it's all about education. And my dad, being one of the first hospital administrators back in the old days in the 40s and 50s, when we only had black hospitals, we were only able to go to a black hospital, he educated me on being out in the community and educating patients on chiropractic care so that they understand what it is instead of a hearsay from Cousin Joe or whoever about chiropractic care. Go to the source, and that's why we've always been in the community. My church, Hartford Memorial Baptist Church, around the corner from my clinic. That's why I set up my clinic in Detroit instead of the suburbs like some of my colleagues. I want to be in the city serving Detroit.
A lot of people are always concerned about costs. Can I afford it? Is it covered by insurance? Are there any other associated charges? How does that differ in terms of what patients are faced with in terms of their financial responsibility for chiropractic care?
Well, the co-pays with chiropractic care, especially with the seniors, is usually only $20 to $35, but that includes anything that we do, the heat, the traction, a pressure point massage on the spine, the actual alignment that we do in the office. So it's affordable, and if they have Blue Cross or Medicare, we take most major insurances, Aetna, we take most of the major insurances and we're able to bill them for what we do, and then the patient has a small copay that they pay, and that covers their treatment. We're able to intake patients from primary care physicians like yourself, Dr. Sharp and Dr. Maddox. We're able to take them in and at an affordable basis treat them and take care of the spine and decompress any areas that are trying to pinch the nerves, which is what they want. They want non-surgical relief now before they wait and they may need surgical relief.
One of the things we struggle with sometimes is the whole inflammation cascade in terms of how pain occurs, what it does to the body, how it's relieved. Chiropractic can address some of these pain syndromes from an inflammatory standpoint of view as well, can it?
Yes, we use externally, and this ointment's been out since the 40s, Ringmaster Oil. It's a black-owned Detroit company. I was one of the first chiropractors to use it in the city. And when Mr. Sewell, the inventor, was still alive, we'd go around to the radio stations and talk about the anti-inflammatory effects of this topical. And then we use internally, sublingual, the CBD, the non-hallucinogenic effect without the THC that helps you. It helps me. I'm still competing as a giant slalom ski racer with the Jim Dandy Ski Club in the over 70 division. And I use the CBD and some of the herbals that help with inflammation so I can still function at 14,000 feet racing down the hill and achieve the silver medal this year in Colorado. So yeah, we have a lot of things that help with inflammation along with the chiropractic adjustment to relieve pressure in the spine, which directly helps inflammation.
Any drawbacks as you see it in terms of age? Is it possible that you can age out in terms of chiropractic care? Do you feel comfortable with people women in particular, who have lost a couple inches of height, got that posture now because they hit 80? Are there any precautions in that arena at all?
No, and being experienced at over 40 years in practice, my oldest patient is 99, and I've got a number of patients in their 90s, and it just works to our advantage to work with them with pressure point therapy and some of the heat and traction that we do, and they love it, and they love the hands-on approach. Because when they come to you guys, sometimes it's just you're giving them something orally or injectable. Getting hands-on approach from the chiropractor as a senior just helps the overall wellness. It helps their circulation. We have some patients who identified with osteoporotic disease, and sometimes their primary care doctor will say, well, don't do this, don't do that. But we can handle that. We can handle that with our experience, and increasing circulation around the joints, even with osteoporotic disease, helps strengthen the joint so it lasts a little longer, even though they've been diagnosed with degenerative disease.
Dr. Glass, thank you so much for joining us today. It's been outstanding. We will do this again.
Thank you, sir.
Good. Our guest has been Dr. Herman Glass of Glass Chiropractic Health Plaza in Detroit. Chiropractic care reminds us that pain management doesn't always have to begin with the medication. Sometimes it begins with alignment, movement, and collaboration. Thank you for joining us for Primary Care. I'm Dr. Lonnie Joe.